Will you join me in the pledge to the flag?
Well, if you insist.
I pledge
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Oh, another one.
Well, he just didn't say it, and I didn't realize it, and thankfully Larry caught it.
Okay. Any public comment? No public comment. Carter? Okay. The consent agenda. Has everybody had a chance to look at the prior week's minutes? And we've already turned in the calendar for check signing has been turned in, so. Any comments?
Prior month.
Prior month, week, month.
I've moved to accept the consent agenda.
Okay. It's been moved and seconded to approve the consent agenda as presented. All those in favor? Aye. Opposed, hearing none, passes unanimously. Moving right along, February 2018 LHD financial report. Cheryl, you're on.
I'm going to go ahead and report on March. Just because.
Is this a typo? Can we let Jen over this?
No, it was probably my fault.
Okay. So it's March.
Yeah, it's March.
Okay, March agenda. Financials.
Okay. Beautiful. All right, so March was a little bit slower overall than the months we've been seeing. The hospital and the emergency room were below average. I have the averages over here, our months over here. Our surgical, however, was a bright spot. They had a good month, both inpatient and out. Our swing beds were right at average, and they had a pretty good month. Ancillary services continue to be strong, but really slowed down quite a bit overall. Lab was way down from their average of 2,600. Radiology is down about 80 over their average. Rehab went up a bit, but they had kind of really tough February. Home health continues to be strong and steady this year, and the health clinic also was down a little bit below their average, so they were a touch slow, but I think that had more to do with providers not being there than patients not being there.
Spring vacation.
Yeah, spring break, a lot of people. Okay, so all of my charts, 2018 is red. It's hard to tell on this, unfortunately. It looks good on paper, but not so much up here. So this is our current year up here. Our charges for the month were $2.87 million. Our average this year is at $2.9 million, so been pretty close to average month charge-wise. Our collections on AR are right here, highest month we've ever had, $2.7 million. We've also completed April, so April was the second highest month this year at $2.24 million. And so far in May, we're kind of headed up to get pretty close to that again. So if things keep going the way they are.
Good.
That software is helpful.
Our days in AR dropped to March, they dropped to 82, and as of the end of April, they're down to 72. So, do you want to give an update on Right Plan and how that's going?
So the software isn't actually helping, it's the fact that
It's the way.
we're working real hard. So we're in the 4th week of the right-hand implementation. We've had training for the staff this week. We've just been, a lot of it's just been doing setup. So I've just been doing enrollments with the provider so we can do electronic billing and get electronic payments in. Surprisingly, we got our first electronic payment in like the day after I set everything up, so that was really cool. Right now we have about 100,000 worth of payments that have come in through, just electronically through the new system that we haven't posted yet. So the turnaround time seems to be quite quick. So we're still working on the training. We're not billing out of RICAN yet, but we will be within the next 2 months. Well, sooner than that probably, because what they do, so they retrieve the data from CPSI because they just snap on to CPSI. So RICAN reaches out and pulls our data through. So they pulled through 3 months of our previous data, and then before we go live, they'll pull 3 years through. So it'll be good tracking. It looks real nice. I think it's going to make things go a lot easier for the team. It's going to be easier to track, better reporting, better work queue. So I do think it's going to make a difference. But I'm pretty proud of the team. They've really kind of buckled down. Well, not just for the last couple of months, because for payments to be that good in March, they would have had to have been working on them for a couple of months prior. So they're really doing well. Got a great team.
Are they named Vinny and Rocco?
Okay. Okay, our day's cash on hand is here at 81. Now, there is $1.2 million out to be borrowed at this point, so if we had been able to borrow that, it would have been 98. And because the bank was a little slow, we didn't get that cash until May 1st, so probably a little bit low in April as well. But the bank is really fine with the covenant situation because they know that the reason why we're under the covenant is because we haven't been able to borrow on the loan. So they're okay with that. Our profit and loss for March. The month, our net operating revenue was pretty close to budget, partly because our contractuals were on the low side. Expenses were very close to budget, with wages being under, expenses, benefits being a little bit over. As we start year to date, we're very close to budget, so we're just going to end the year a little bit over budget for benefits, with the health insurance going up a bit more than we planned. Materials and services under budget, total there is 16. So then we had an anomalous, we have an extra $100,000 in depreciation that we booked because we were discussing with our, auditors. There's kind of that moment in time where you go from capitalizing interest to depreciating, and we decided that we had started that a little bit late, so we went back and picked up some depreciation on Lakeview Garden Building. So, otherwise that would have been a year-end adjustment, so I'm glad that we're doing it now. Total expenses are a little overall total under budget. Our gain was, our loss was, operating loss was 304, non-operating income was 190. So our net loss for the month was $114,000. Year to date, we still have a net gain of $748,000, which is $647,000 ahead of budget.
Is a big part of that gift?
$350,000. Balance sheet. So our current month, it's in green. Overall, our cash has gone down a bit as we are paying on the building. That, it's been significant. Our collections are up, so our AR is down a bit, which is a very good thing. And our debt is down a bit because we have been paying our debt, but we didn't borrow more in March or April. So that's kind of where we're at with the balance sheet. Okay, any other questions on Lake Health?
Questions?
All right. So currently, Shelley McLeese signs off on a lot of documents for American Funds, which is our retirement thing, and you sign off on parts of it. Shelley signs off on parts of it. We'd like to add Tasha as a secondary to Shelley, because Tasha does payroll. She can do the whole entire payroll. So she's Shelley's backup, and we would like to add her as a signer on that with your approval.
Do you need a motion on that?
I think I do.
So moved with authorization authorization for Tasha.
Been moved and seconded to authorize American Fund signer Tasha. All those in favor?
Aye.
Her complete names, Natasha Stark. So
Tasha Stark.
Sorry about that. All right, second.
Okay.
The second thing that we'll need a motion on is to declare our old S10 pickup that is really ready to be replaced as surplus, so we can, no?
No.
Gerald?
I was so moved.
Okay.
We declare the S10 pickup surplus.
Do I hear a second?
I'll second that.
Okay. Moved and seconded to declare the Chevy S10 pickup as surplus. All those in favor?
Aye.
thank you, since we did it already. And we had your approval. Just informal.
Uh-huh. All right.
Who's like medical services? Limbs.
Okay, so March, we had 695 patient days, which is equal to 23 patients. Been pretty steady at that number for several months. I'll fix these for next month. I know this March is bad. But anyway, this is our month here in March. And we had $207,000 in revenue. I mean, it's been a super steady year. The P&L for the month, we had the 207 in revenue. We had quite a huge amount paid out for contracted labor. Benefits were average. Supplies and services are high because we underestimated the quarterly tax bill, so we accrue for it in each month and pay it in this month. So we have about $7,000 in makeup to do there. And then also we are buying some pretty expensive equipment to transport food from our kitchen here to the residents over there. So that was kind of expensive.
How
So
close are we to being, getting away from that tax bill?
I don't think we're anywhere near close to it. I don't think.
When we move people into assisted living, it's not going to help get us
I
up
don't
to
think it
that.
depends on who we move in, but I kind of,
It's actually going to hurt us because the two people that are moving into the assisted living are Medicaid. So that's going to impact that right now. And we're running steady at about 73% Medicaid resident occupancy. So that number is kind of low because there are some families here that are able to afford the private pay rates. So
What's the percentage that is break?
80,
80,
I think it's 85.
85, yeah.
we've never really been,
We've been close.
We've been close. We talked about it by moving some people into the assisted living, putting the Medicaid people continuing in long-term care. It's been close.
yeah.
or
Unfortunately, sometimes those people that aren't the Medicaid recipients still need to, they physically can't move into the assisted living. So yeah, we deliver the care that's appropriate in the appropriate place.
Okay.
Keep watching it.
I know it's, what, 150,000 a year or so? I mean, it's,
Yeah, it's,
145.
yeah, it's quite a difference between
This year and last
Yeah.
year.
yeah, I think it's even maybe more than that, so, yeah, it's kind of great, but $15,000-$20,000 a month, yeah, okay,
It's quite a big difference between year to date this year and a year ago.
yeah.
I think we have an aging population.
Okay, so Goose Lake Medical, they've seen increasing patient counts for the last 2 months, and I hope that trend continues. Their revenue was $50,000 and their loss was $12,000. Year to date, it's $207,000. We did get $25,000 back on the cost report that wasn't booked yet. That came in March, so that'll be reported, April, so that'll be on the April financials. And we also got, from the state of California, that will be deposited in May at
Just say it. Okay.
$11,000. Well, this is pretty good. We're this is where we need to succeed and to make some money, but we did get $11,000 from PHP for meeting some of our measures, and we feel like with the group we have and helping out with them down there, that we could do much, much better. So I'm hopeful that that'll be, the next check will be bigger.
I was referring to the state of California.
Oh,
That
yeah,
part.
yeah.
That's why I'm skeptical.
I know, that's true. Still, on the license transfer, received a request for more information that was redundant and seemingly appears to be just another stall tactic, and the auditor is responding to it and griping at them, but I don't know what to say. At least they're doing something, but that's all I can say. And Katie has not gotten back to us on our latest request, so I should get an update again in another, I hope, a few days. But we've been talking to her almost weekly. Lake Health Medical Supply, they had a net profit for the month of $5,000, $35,000 for the year, so they seem to be picked up over last month, and they seem to be holding steady now with their holding group of people, so that's good.
Did I see they have about $500,000 in assets now?
You probably did, yes, because you own all those oxygen concentrators, and yeah, so there's debt on the concentrators, and then there's the asset, and it does take a little while to recoup your money, but well, I sure think that it's a huge benefit for people on oxygen.
Right.
And it really is going to be a moneymaker over time. It's kind of a win-win. It'll take us a little time. Okay. Done.
That's it. Any other questions? Hearing none, we'll move right along to construction update.
So we have a couple things to talk about.
Didn't we do we just did Lake View Gardens? didn't we?
Lake View Gardens update.
Oh, that's,
Oh.
Update. Oh, excuse me. I'm in the old financials.
so this is an opportunity for Larry to talk a little bit about.
Yep, sorry about that, Larry.
No, you're fine.
Skipped right over you.
So, as you guys know, we were experiencing some difficulties with the grout in the bathrooms, the kitchens, the spa room, and the public restroom. That, for the long-term care, we're scheduled to start that on Monday. And I've been working with Jim to figure out a schedule we have 3 open rooms in Wild Plum and 1 in Lilac. So we're going to replace the grout in the 3 open rooms in Wild Plum and then the 1 in Lilac. And it's going to take about a day for the grout for them to tear out the grout, re-grout it, and then seal it. And then the next day we can move the residents into those empty rooms so then they can kind of do all the rooms 3 at a time, while one 1 at a time in Lilac House. So we're looking at 4 days total in Wild Plum and about 13 to 14 for Lilac House.
It only takes a day.
It only takes a
I
day.
thought we understood it was going to take 4 days per room.
Yeah, that was really surprising with, that they found out in the Lily House, when they did that one first. They found that the grout was extremely hard, within 4 hours, hard enough to seal. And we went and checked all the rooms and the kitchens. In the kitchens, they don't have to replace the grout, they just have to reseal it because it's not constantly being scrubbed like the shower rooms. So we just have to reseal the kitchens and it's up to our standards. And it's going to be a lot more convenient for our residents to have to be moved out of the room only for a day, so we don't have to take all of their belongings and prepare for a whole week or 4 or 5 business days for them to be out of their rooms.
So what are we looking to move into the assisted living right now? Do you have any idea?
We have a confirmed date of June 4th.
June 4th.
June 4th.
For real or for anticipated?
For real.
So we can go to the bank with that.
Yes, we can.
Just so that you know, on the grout replacement, all the costs for the labor and to do this is being borne by the grout manufacturer. It isn't Detroit, it isn't the country, it's the manufacturer. So,
Except the cost for your staff.
except for the cost of our staff. That's right.
So Larry, back to this move-in date on the 4th, how many people will that be?
We plan on moving 2 people in a week. So that first week on the 4th, we plan on moving 1 person in on Monday, the 4th, and then Wednesday, the 6th. And then the following week, we're moving in 2 people in Monday and then Wednesday as well.
Can you explain to me why only 1 person a day?
1 person move in a day? We need to space out our move-ins. So, because we have to do a 30-day assessment for the first 90 days that they're in, and then quarterly thereafter. So if we move 10 people in the first week, it's going to really back us up when it gets to those, the 30 days for the first 90 days, and then quarterly thereafter, and then the annual assessments. It would be a lot of work, and it just wouldn't be feasible.
So every week for 6 weeks, you're moving 2 people a week.
Right now, we have 5 people that we have done assessments on and received doctor's recommendations that they are able to move into an assisted living. We have had some people a little hesitant to move in due to the negative publicity of the move-in of the Lakeview Gardens long-term care. So they want to see how we open, which I have no doubt that it will be a smooth transition and the community will be very happy with the process of the assisted living.
So are these 5 people that you know are moving in, are they coming in new patients, or are they transitioning from long-term care into assisted living?
2 of them are from our long-term care, and then 1 of them's from Portland, moving back to Lakeview, and then 2 are locals.
Okay. More questions, because we're overdue on this, and I'm glad to hear that this is a confirmed date. We do not have then a waiting list to get into assisted living, is that what you're saying?
I'm hoping with the positive outcome of our opening and the community sees how well it's working out, I anticipate having those people on our previous waiting list come back and would want to move in.
So those people previously dropped off the list?
Yes. They're still on it. They just want us to contact them after we're open. And we have had quite a few residents on that list pass away or move into another assisted living in another town.
And we've got people ready and willing to work.
Yes. So due to some unfortunate events, we had to replace a couple of people. All of our training will be done May 23rd. So everyone will be prepared and ready to start June 4th.
What size staff do you have to have for that 1 person?
We have to have a state mandated staffing plan for acuity, and the minimum is 1 medication assistant and then 1 caregiver. So for the first, until we reach a certain acuity, we will have that certain staffing, let's say for the first 7 residents. And then if the acuity increases, then we'll have to add another caregiver onto that staff for day and evening shift. And night shift is typically 1 medication assistant and 1 caregiver. And the reason why we have to have 2 minimum on staff all the time is for a 2-person transfer, or if someone falls and has a non-injury fall, then 2 people can assist that person getting up. That's a state standard.
So you don't have to add more people when you move a second person in?
No. Only until we reach an acuity. And we have to create an acuity system to present to the state before we get our certificate of occupancy.
What's that number?
That number is based off of points, and it's 36 points.
But how many people can you move in prior to that? I mean,
Oh.
is that-
It kind of depends on the level of their level of service when they move in. If we have, say, 8 level 2s, we will only need that 1 medication assistant and 1 caregiver. But if we have 6 level 4s and 2 level 3s, we will need that additional for that same 8 resident population.
Any other questions? Thank you,
Thanks, Larry.
No problem.
Thank you. Okay. Anything else, Larry?
I don't think so.
Okay.
I have one other item I need to bring up. We needed to purchase for Lakeview Gardens 2 unbudgeted items. There were 2 bariatric beds. We have patients that, the beds that we have aren't able to withstand the patients. So that was unbudgeted. The cost of those beds is $9,631.
Total cost.
Total cost of the 2 beds together. It's important.
Hope we got a CERTA for that price.
Just repeating what one of mine costs.
Wow.
I stuttered when I saw that, but
Right.
from a patient safety standpoint, it's something we have to do.
And is that's the long-term care part?
Yes,
And we supply all the beds there.
we do.
But the assisted living, do they supply their own furniture? Yeah.
So we just need to make sure that we're protecting our patients, and so it was unanticipated. So I needed to let you know
I do have one more thing.
that. Okay?
We started a Lakeview Gardens Patient Family Advisory Council meeting, and that has been going really well. The families, we've had quite a good turnout from the family members of our residents, and they're very pleased to hear monthly updates on where we're at, where we're heading, and being able to answer their questions, separate from the hospital one, which Teresa really helped us out, getting our foot in the door on that, so thank you, I really appreciate that. So the families feel like they're part of our team, and they can raise questions and concerns, and we have answers for them. And then if we don't have the answer right then and there, we make sure we get back to them within the week, and they've been very appreciative of that.
And one last question, you have the meal situation ironed out, how we're going to get meals across?
Yes, we have that plan confirmed with Tara today. We're going to start that meal service starting the 29th, the day after Memorial Day. And we're just going to run it, all 3 meals that week and through the weekend to make sure we iron out any details that we might have foreseen before the go-live date on the 4th for the assistant.
Okay, thank you.
Oh, and, sorry.
One more thing, it keeps going on.
Teresa reminded me, thank you, that we are, one of the main things that the families were concerned about were having a nurse on in every house for every shift. I'm happy to announce that we are at the staffing level now that we can have a nurse in each house on day shift, so it's a step in the right direction. There are 6 days that in the month of May and June that we don't have a nurse in each house, but that's because of vacation coverage. So we're happy to bring that to the attention of our families because that was one of the major concerns. And we're getting a lot of positive feedback from the families and their staff as well.
Okay.
Is that a necessity from our requirements?
No.
It's a little bit over. But it was a community request.
Right.
Larry, did you say that that your group meets monthly?
Yes.
Not just as needed, but you have just an ongoing monthly meeting?
Yes, it's every 3rd Thursday of every month. And right now we're conducting those in the Lily House. But I'm happy to announce in June that location will be changing.
Okay, thank you again.
That's it this time.
Okay. Okay, Charlie, construction update.
Several things have been going out. First off, we moved into the new clinic space. What the contractor calls, they view it as 1 is the specialty clinic, 2 is Lake Health Clinic, 3 is the Warner Mountain Medical, and 4 is the new building. And then the core check-in space is the addition. So we moved into the check-in space in building 4, the new building. It's gone pretty well. We haven't had too many lost patients. Some we've We've had to change some of the doors, shut some of the doors, because people do get a little bit confused. But it's settling down, the practitioners are getting comfortable with their space, with getting some of the heating and air conditioning issues worked out. Fortunately, it's not too hot yet, because they had a little trouble, but that is now being done. The second part, you recall in our drawing, do we have that? We have the drawing now. When we talked about there was going to be a two-phase of the temporary, should be two. Right there. Back, down, one. One more. There.
Up, one.
That one.
Yes.
You need glasses.
Right. Look, my contacts are a little blurry tonight. I can't read this little.
So just to make sure that we got this clear, this is the central check-in. This is building 4, 2, 1, and 3. Everyone clear on that? So what we did was patients walk through here and go through a tunnel that we created to get into the clinic. We had to put a door here because people kept walking in here and they weren't quite sure where to go. So we fixed that. Second phase, we're going to lose this corridor because of all the work that has to happen to this wall, some of the connections on this side, and as it connects in here. So the contractor has built a 3.5-foot tunnel, if you will, through here. This is exterior, so patients will walk outside, or family members, and then get into the hospital. This will happen on Thursday, a week from today, so that they're going to move in. And they will close off this corridor, doing the work. We'll have signs as much as we can. Still, there are some confusion. It'll be between 6 weeks and 2 months. They think they can get it done during that time. They're saying 2 months at the outset, 6 weeks is there. Any questions on that? So, you may have noticed they've been painting the outside. It really does make the building look nice as it's moving along.
Now, are they in 1 and 2 working now?
Oh, yes. This whole space, in fact, they had to figure out where some of the bearing walls are and had to shore up some of the footings because they didn't have the footings in this. They're working on gutting this and getting it ready. They've already moved the door that was here to here. They're moving along. They're still anticipating being finished. They say by the end of the year. I asked them yesterday, so does that mean they're going to work between Christmas and New Year? And I said, well, no. So that means you're going to be done before Christmas. Is that right? And they said, yes. So does that mean they're going to be a lot of work happening between Thanksgiving and Christmas? We'll see. So that's their tentative plan. Next is the what's called the change. Did you? Let's see where you at. So it's called the change request log.
Oh, I don't think you sent that to me, but
Okay. So then I apologize. I'll email it to everyone. So what this log consists of, and we have this every one of our meetings, and we go through the changes as we're doing through the construction process. What it started off with, we start off with our original construction price, $4,819,483. That was the original estimate. And then as we go through things, there are things that are added from that process and things that are subtracted from it. So, for example, we started out in October with a couple of changes on the site design. That was a drop of $14,500. And it's a whole series every month that we go through this, additions or things that we hadn't anticipated. And the current approved total is an additional $90,000. And we have still, we're working on, is about $80,000 in addition to that original $4.8 million. Now remember, we have a contingency, and that was part, some of this comes out of that contingency. Things that, for example, we paid an extra $18,000 to have the geothermal on the front of the entrance to the building added in. That had to include the redesign, because they really hadn't planned on that originally, how they got the geothermal water there, the pumping system. So it's a constant change, and we review it every time. Is this appropriate, is this not appropriate? So I'll email that out to you. So that's the status of how that process goes. If any of you want to sit in on any of the construction meetings, we have the architects, we have the engineers, the construction company, and typically Justin and I are going through each of the items. And you're always welcome. Any questions about how the process works? Okay.
Thank you.
Sorry, I thought I'd have that.
That's okay. I believe it's your turn.
Well, I thought today I would do something a little different, so I brought our report card, I guess it is. This is what goes in, and some of the data that we submit as a hospital, and it goes ultimately onto that Hospital Compare website for Medicare. So if you're looking at the first one that has has yellow and green on it, you're looking at what are called our HCAP scores. And you can see the furthest quarter over is one for 18. So that's where we stand right now. It may not be fully completed because numbers come in a little, or surveys come in a little late. So these are the surveys that patients complete after they leave. So these are inpatients talking about their care. And it gives you a little bit of an idea of where we stand. There has been a little change in one of the questions. So question 4 is new. So you can see that we only have a score on this first quarter of 18. And question 9 will be going away. So Medicare is doing a lot of work now because of the opioid issue epidemic. And so this question talked about having your pain completely relieved in the hospital. And so they're revising that question to just say, was your pain addressed? Because they want to get away from the idea that nobody ever has any pain ever, because that's part of the mindset that is contributing to the problem. So anyway, other than that, it's pretty straightforward unless you guys have any questions about it. Okay? It's not all green, darn it. We still have a few things to do.
I didn't see any red, that's correct.
There's no red, that's good. No red all year.
Discharge information, why do we, is that the patient's point of view?
That's the patient's point of view.
Okay.
Yeah, which is interesting. The patient's point of view is always interesting. So it's a little hard for me to drill down on exactly why that isn't green. But I think we need to focus on it a little more. I was thinking about that as I was sitting here. The next one is more related to ER. It's more related to patient care as opposed to patient perception. And one of these is inpatient, you can see that, and the other one is outpatient. So these are measures that were measured on in relation to certain patient types, as well as our overall patient speed of care for patients, and then how well we do in the inpatient setting, how well we do getting our patients immunized for pneumonia vaccine, as well as influenza, and preventing the venous thromboembolism prophylaxis is preventing blood clots for patients that are in the hospital. So we've made several really good improvements in these areas. You can see in terms of our ER outpatient measures, you can see that we still struggle with our timeframes. And that unfortunately is partially related to the fact that we don't always have a provider in-house. And then, of course, our transport times are long because there's no way around that. If we're trying to get to the door of another hospital's ER, the transport of an airplane to us and back takes us outside of just flight time alone takes us outside of the national norm because of the length of time that takes. But we've made some improvements, so you can see some of the things on quarter. This is for only 17, so there's no 18 numbers in here, but you can see that we've improved some of our numbers toward the end of 17. And I can tell you that Abby's been focusing on this more as time passes, so.
What's the difference between an AMI aspirin and a CP aspirin?
Chest pain and acute MI, it just means one is already diagnosed. We already know it's an MI, whereas with the chest pain, it's just a patient presenting with chest pain. So that is part of the interesting results here. NOM thinks that that's a really low number too. That's another reason why that is at 0. We're a little more skeptical about chest pain than some of the other hospitals. Our providers take a little more time to diagnose before they treat. Whereas if we know it's an acute MI, you can see that we did that 100% of the time. And then the last sheet that I had for you was stroke data. So this is kind of a new focus for us. We're really focusing on this more, and our providers are starting to focus on it more. We'll be you're actually getting these numbers before they do, but we're looking at some of the various measures that we report through the national reporting portal, which is called Get With The Guidelines. So that first one is a screening tool, and our numbers are improving, but we aren't there yet. You can see that we have some greens that have gone up since 2017.
Is the goal our goal, or is that national?
That's a national goal. Yeah, so that's national over on the right. So yeah, thanks for pointing that out. So we still have a few things that we're working on, but our providers are starting to pay close attention to this, and we're putting some different protocols in place to make things go a little faster. So just some FYI stuff, unless you have some questions. My only other thing was to brag about the team. Today we were at 118 days without a fall. So we had a little celebration for that. So that's the longest we've gone. So that's really good. Any questions for me? Thank you.
Good job, thank you.
I do have a question. LKW, what's that?
Lakeview.
Lakeview.
I think, is that it? It's,
Yeah. Lakeview to the right.
yeah, that's Arrival. That's the one that's pretty hard to do, especially if the weather's bad.
Yeah.
Quite a difference between the 2 years.
Yeah.
Okay, thank you.
I want to point out that that was your board education.
Thank you.
Do you want these back, Teresa?
I'll take them.
The public health agreement, Charlie.
They don't have to.
Okay.
They're public knowledge.
I'll talk a little bit about where we're at. Met this morning with Collins from the county and reviewed the latest iteration of the public health agreement. It has been sent to the attorney, Gwen Griffith, who wrote most of the contract. So it's been looked at by the Oregon Health Authority, it's been looked at by the county's attorney, and made some minor changes. Kind of changes that they've made, for example, are that one, the public health administrator would be assigned specifically 0.05% of her FTE would be paid for by the county. That's 2 hours a week. Rather than in our original agreements, which would keep track of time, and then we would charge back to the county. They wanted to have something firm that was defined. This is what the Public Health Department in Salem wanted to have. That's not really an onerous change, especially since, for me, the big issue is we need to make sure that the public health administrator gets full benefit as a full-time employee. If you start splitting their time, they don't get benefits in either place. So you want to make sure it's fair to them. And this allows it to be fair to them. Second part, which the county administration didn't quite know, is in some of the environmental health surveys that they do, they charge the restaurant, or they charge the hotel, or the swimming pool, whatever. They charge to do that evaluation. A portion of those dollars go to the state. The original agreement didn't have, and so the state wanted to make sure they got their portion of those funds. So relatively minor issues. So I believe we're very close to having an agreement. The goal is to have it effective July 1. The plan, according to what the county would like to do, is have a meeting in 2 weeks, a public meeting for community partners, employees, and interested people to meet at the, during a commissioner meeting, if you will, voice concerns or voice anything related to this. If that goes well and the answers are able to be addressed, why this makes sense for the county to do, or the district to do, then we would have an opportunity to give to you the final agreement. I don't think there'll be any changes, but and the county commissioners would be able to approve. So I think we're very, very close. I don't think you have to approve it yet. We have it as if you want to approve us moving forward, largely because from a budgeting standpoint, in May 24th, when we have our budget meeting, we want to make sure that we have, now we did put it in our budget last year, but this year it looks like it's really going to happen. If I didn't want to move forward. So, I don't know if you want to vote on moving forward with this, knowing you don't have the signed agreement or the final agreement in front of you. Or you want to wait until the June meeting to finalize it, however you want to. What do you reckon?
Whatever the comfortable is. Whatever you're comfortable with.
Discussion?
You feel like you need to have it.
I would just assume read the agreement.
So,
Okay.
Okay.
I can get the agreement to everybody.
Yeah. Okay.
Perfect. I just wanted to keep you up on how the changes are going, where we're at on that. Interestingly, as part of the conversation, the space in Christmas Valley, where that the county has, there's greater opportunities for us to share with mental health services, as well as the space in Northland, and we're still working with them. So it gives us some better availability for service in that community. But I'll get that agreement out with, and what I'll do is I'll send you the red line agreement so you can see the changes.
Okay.
Is everyone comfortable with getting a red line agreement? If not, I have copies right here. So I can, however that works for you. Check.
Okay. Dr. Graham is not here. Medical staff update?
We don't have any credentialing that we're dealing with at this time.
Patricia Gainey.
yes. So Lakeview, one of Lakeview's homegrown, Edwina Hope Arrington, who has finished or is finishing nursing school with a 3.83, has been accepted into the Family Nurse Practitioner Program with OHSU. And she's very excited about it. She's going to be working PRN in acute Butte, I believe. She had interviews this week. And then she will also be attending school as well with OHSU for family nurse practitioner. And she would like to continue again because she plans on, staying in Lakeview when she's done with her education. She would like to continue with seeking funds with the Patricia Gainey Johnson Scholarship. So I would like to propose that.
What was that total dollar amount again?
$8,400, $8,400 in the academic year. So I would like to recommend that she be approved to receive additional funds for the 2018-2019 academic year.
What was the number? I saw that was like 9,000 per term.
Her tuition costs?
What was it? Maybe it was total costs or something. I was thinking I read it.
That's a term, so her fall term is $9,180.
So where do we get the 8,400?
Oh, the 8,400, that is the cap for the maximum for the
That's our
Patricia
cap.
Gainey
Okay.
Scholarship Fund, yeah, per academic year. So that's what the district would be contributing toward her education that she would, earn back when she came to work here for us.
Does she get some other scholarships?
That I'm not aware
She
of.
does.
Okay.
And I might add, what she told me was that she's also been accepted into the doctoral program that she's working on. So she's really very excited.
Okay.
And it's pretty impressive.
She has a full ride scholarship. Oh, that's good to know. Didn't know all of that.
So do I hear a motion?
I will so move that we approve Hope Arrington as a Patricia Gainey Johnson Fund.
Second.
Okay, been moved and seconded to approve the application for the Patricia Gainey Johnson Fund. All those in favor?
Aye.
Passes unanimously. Good. Okay, that, we just had board education.
That was done by,
You're welcome.
Okay, thank you.
Thank you.
I had some other documents, but in the interest of time,
Thank you.
I
Sorry,
thought, pardon me?
sorry.
No, I think that's marvelous what you did.
Employee recognition.
So I think, I hope all of you know that this is National Nurses Week. So across the country, we have hospitals and communities have been honoring some of the most important people in integral to the healthcare system. And I think it's honoring the birthday of Florence Nightingale, if I'm not mistaken. That's what really got National Nurses Week started. So we look at a lot of nurses, and we're really very fortunate to have some exceptional nurses. Some that have been nurses for a long time, and some that are new nurses. And when we look at each of the nurses and what they contribute, sometimes they grow into their positions, and sometimes they flourish from the beginning. And the nurse that I'd like to honor this month is a nurse who is a new nurse, but is doing really well sometimes in a little difficult condition. Because a lot of nurses, when you're learning your profession, they rely on their support from others. Sometimes they are working a little bit more on their own. And this nurse works a little bit on her own while she is doing what she's doing, and then gets support in other areas. This is Katie Ogle in our infusion therapy. She's done an exceptional job in a difficult time. It's not a full-time in that position, and it's scheduling issues, but she's doing a really good job and working with our patients. Katie Ogle, sorry.
Very good. Employee appreciation.
No, it's not at all. She's not local.
She's married.
CEO report. Thank you, Charlie. We'll go home.
Excellent. I'll try to either speak fast or not list everything. As you know, we had our board strategic planning meeting last week, so some of the things that I don't necessarily want to talk about just those things that we talked about, but some things that you might not know about. We participated in the state-funded program called the Oregon Listening Tour, as did many other hospitals, rural hospitals. This is now available to be in hard copy. We'll send you the link for the website. It goes to all the legislators. It goes to a lot of people that look at the delivery of rural health. You'll see information about how we compare. A lot of it was on mental health. So there is more and more interested in finding out what are we doing about mental health in rural Oregon, what are we doing about substance use disorders and other kinds of things. So hard copies are available. I'll send you all a copy. We'll have a copy on our website. So that helps people to understand a little bit about some of the issues and what some organizations, what our community as an example, are dealing with. The Intelare change. You may recall I talked about how we are changing at the recommendation of Quinton Wilson, our new, what we're now calling supply chain management, not purchasing, because they, as Quinton says, they do more than just buy things. They buy and supply, do a lot of things with the materials that we manage. So we changed with our purchasing agreement, and we went to Intelare. You've heard us talk about this. At their recent meeting, they talked about a change within the Intelare contract, going from Owens & Minor to Medline. In that process, they're estimating that our savings will be about $21,000. So it's a pretty positive thing. That's before we start making changes or suggestions to our providers to change some of their behaviors. Different clubs. Sometimes clubs work, sometimes they don't work. But convincing the practitioners to use different sets of gloves can save us money. And there's lots of examples of it. So that's a positive thing for us that we're hoping we'll see actually comes to fruition. We have several surveys that are going on in the next couple of weeks. The mental health survey by the state, since we're the CMHP, Community Mental Health provider for the county, that survey is the 23rd and 24th, so they'll come out and do that. They originally scheduled that for November and then discovered weather and decided this is a better time to visit Lake County. Lakeview Gardens, we've been anticipating a state survey, well, I think for the last 3 months. We wait every day or start off on a Monday wondering are they going to come. It's typically a 3 to 4 day survey, so we expect that at any given time. We're also being audited by the federal government for a 340B program. It's a random process of selecting hospital, whether big or small. And so our pharmacy organization, AmerisourceBergen, is helping gather all the information. The 340B program is where we buy a drug. It's typically a high-priced drug, and then the manufacturer supplies us with the same drug at a much lower price. We get that savings. On average, we save about $150,000 a year for the last 2 years through this program. You may be aware that Congress has looked at this program frequently. The pharmaceutical companies don't really like the program. They'd like to give up that $150,000. And so they're questioning, and some organizations have been being a little more liberal in their policies. We're very careful with it. One of the things that's exciting, I think, about what we did this past year in dealing with the influenza situation. Historically, well, the year before, we were ranked about the worst, second to the worst hospital in the state of Oregon in terms of getting our shots. Mesa Greenfield has been, when she became our infection control and employee health nurse, she got after it, and we set up some policies. This last year, we had 261 people get their influenza vaccination. We had 29 people sign reasons that they didn't need to have it done. They had medical reasons. That's a 90% coverage rate. And why is that important? Studies show that hospital employees, if they don't have a vaccination, what is it, they're 10 times or 15 times as likely to
10, it's something like 12 more people in the community will get influenza for every healthcare worker, not just nurses, every hospital employee who doesn't get vaccinated or gets vaccinated, whichever way you want to look at it. It's a huge effect.
Is that part of this core measures?
I got migraine.
This is for patients.
That's influenza for patient, vaccination for patients while they're on as an inpatient. We do report though, we have to report to the CDC what our influenza vaccination for employees is. So that's a different report that I didn't bring in.
So one of the things that you can't directly correlate, but the whole state of Oregon had a very aggressive influenza. There were a lot of people that got the flu. In Lake County, there were 15 positive influenza A, or 24 positive for influenza B, and 1 positive for both A and B, with 6 patients admitted for influenza. We had a very light touch. Now, did our employees getting their vaccinations have a great impact on that? Can't say it directly, but I'm venturing that had a pretty significant impact on it. So I think that's important that our employees really did a lot. And not everybody agreed to have their shot, but it was a struggle. I think they did. Mesa did really well. And
I noticed several white hospital.
so that was a big move for us. Another thing that we're doing, every year we've been supporting helmets for kids. And we've also, so we get money from the state to help buy some helmets, give those to kids. Abby Finetti has started a program. It's a really incredibly fun program. We give out coupons to kids, we do. Police officers give out coupons to kids to get an ice cream cone if they're wearing a helmet on their bicycle in the summer. It's a pretty slick deal for the kids, and it really helps to promote a healthy behavior. We're going to be continuing doing that. Our food share program, that will be continuing. Many of the service clubs, not all of them, but many of the service clubs are volunteering to help in providing sandwiches and lunches for kids throughout the summer. We're doing this again this summer. It made a lot of difference. When we look at our grants, I asked Christy Alverson to give me a little update on how we are doing with grants. To give you an idea, she's working on helping in processing. Some of it is the Eastern Oregon CCO. It's about $166,000 that we have received as part of that Lake County. It's not all the Penn district, but of that $35,000 for a teen fair, a variety of other things to try and encourage healthy behavior, and yes, to focus on our metrics. We heard about the $11,000 we got from the California equivalent of our CCO. We got a fair amount of money, so we got money to help us get there, and then we're getting money. The total dollar amount in the grants that she's working on right now is $347,955. That's a lot. Another $10,000 on patient safety, $6,800 as part of the food school grant program. So it's a lot. And that's money that we did not have. And I think she's doing a great job to help us get there. We recently participated this last week in a multi-statewide trauma simulation drill. You may have heard about this. The participants included the hospital with the acute care, emergency department, lab, x-ray, pharmacy, IT, all the departments. plus the Lakeview Disaster Unit, Paisley Disaster Unit, Lakeview Dispatch, the Air Links in Charles. It's a huge list. What was amazing is not only did they go through that trauma survey, and it included the Office of Rural Health and the Idaho Simulations Department. It was a pretty big deal. So while they were doing this survey, we had a real disaster come into our emergency room, and they were able to handle both. It's pretty astounding to think what our team could do. So I think it's pretty exciting. We've talked about, with our mental health services, when we took over, historically, the CMHP that the county had, there's an association of other CMHPs in Eastern Oregon, CMHP, Community Mental Health Practitioner. They formed an organization called GOBI, Greater Oregon Behavioral Health Institute. And historically, the county had a seat at the board. We haven't had a seat at the board for almost 2 years. We were just invited, and Trace Wanzer, executive director for the office, will be able to sit at that table. So David has looked at some agreements, and it's pretty good. So that's kind of a great thing for us. It continues to show that the outside organizations are looking at what is happening with mental health, and they're saying you warrant being part of the greater process. I think that's a sign of what they're doing. One of our employees in our maintenance department has just recently gotten a certification. Brandon Hilleman is now a certified HVAC worker. So he has his license for that. That's a great thing to add to us. He worked under, if you recall, Shay Robinson worked for us for some time and he left. Brandon will now be able to do a lot of the things that Shay was able to do. That really supports our organization. And we helped him get there, and he's going to be staying with us for some time. So that's an exciting addition for us. We talked in the past about the need for us to look at our electronic health record. And we have had a company called Cerner here for it was 2 weeks ago. They went to department to department and gave a presentation what their software does, and how it is integrated and what it could do for us. We are going to be looking, we've had presentations by CPSI, and they talked a little bit about what they could do to bolster what we're doing. We've had presentations by Cerner. We've probably arranged to have members of our team go and look at other sites, get an idea of whether it works or how it works and what impact it would have for us. Epic is another of the big brands that we will undoubtedly look at. We will not be large enough to get Epic on our own, so we would have to partner with another entity. Cerner has they haven't given us the pricing on it yet, so we're still a ways to go. But their pricing, they understand where they need to be. In order to access the Epic software, we'd have to partner with an organization like St. Charles or an organization like OHSU or Providence or Legacy, one of the many that are big participants in it. My goal is to have a recommendation to the board by the end of summer on whether we stay with CPSI or go to a different vendor. If we go to a different vendor, whether it's Epic or Cerner, that would be our position. We're not anywhere near, but that's our plan to get to that decision. One of the companies that I had thought we would look at is Athena Health, but while they have done well in private practices, they're an exceptional program for that, they haven't done as well in hospitals. So you don't want to jump from one system into a less robust program. So I don't think that will be a viable option. That may change, but not at this juncture. In terms of providers, we've had a couple changes. Dr. Foster has started. He's been working here in our emergency department for quite some time, off and on. He's now here full-time, seems to be getting his sea legs, getting adjusted to how we do things, learning the different software programs. He's been pretty busy and seems to be reasonably happy with his decision to move. With Dr. Lee leaving more abruptly than we anticipated, or would have anticipated, we're busy looking for some temporary coverage to support the practice because everyone's busy now. It's been a little bit busier with our both doctors Gallagher and Hussey having gone to the trauma center conference, and then very shortly they will go into an opioid pain management conference. That makes it more difficult for patients to get in. So we will be finding some temporary practitioners while we work through adding additional people. We do have a couple of other practitioners who have expressed interest in being here and are interested in moving forward, but they're not operating the same timeline that we are, because we have issues to deal with today. We will have a temporary practitioner that will be new to what we've had in the past. It's a psychiatric nurse practitioner. We currently have a psychiatric nurse practitioner doing telehealth through Peace Health in Portland and connects with our wellness center by Skype, if you will. This practitioner will be here some of the time by the computer Skyping and some of the time physically here, off and on for a couple weeks here and then gone and back. So that'll be throughout the summer. That will help us in our wellness center as well as supporting our practitioners in the clinic. So some new changes that we're moving forward. Do you have any questions about other things that we are doing? That concludes my comments.
Thank you.
I do. Were you going to talk about a building purchase?
I will in executive session.
Okay.
Okay, and with that, we'll move to executive session, come back in 10 minutes of 8, and we'll go into executive session under OS 192-660, bracket 2, bracket A, personnel, bracket C, medical staff, bracket H, legal, and bracket I, real property. As opposed to fake property. So, 10 minutes break.
Okay. That's you. So you're on that.
So you want to sound like Donald Trump?
Yes. Okay.
Yeah, you want it.
Because I'm not here tomorrow.
Well, bringing those three guys home.
Jay sent me, somebody's read some of the blue. And I'm not sure that all the
Last month.
Night duty check.
Good night, last one.
Jane is not going to be able to do the checks on the 30th, is what
When he
any one of us would like to volunteer to May.
Some of those changes.
Yeah. You've been gone a long time.
Out of town
This is.
You have.
on the 30th.
I think I'll be here, Don.
Okay.
Were you?
Thank you, sir.
We expect the 30th. Oh, that's Jane.
Oh, that's Jane.
Jane's
Either. No, either.
Okay, I got it.
You?
You got it? Okay.
Hey, Don.
Chuck has a 30th.
Okay. How do you feel about electronic signatures?
I'm fine.
Okay, good. I'm moving credentialing in-house and I'll have that done soon. And so Whiteboard won't be doing it for us. So all of our doctors have agreed, they're all about clicking a button and writing. So I'm gonna try to get all of the, both the doctor side of it for their stuff plus the hospital side and our
Or just-
privileging, I'm trying to go paperless.
And/or just.
So you guys will have it
You're using
presented.
DocuSign or?
It'll be either DocuSign or an Adobe. I'm working on trying to figure out the best way to do that, but I think DocuSign's gonna be the way to go. I'm trying to go,
Is that for our checks?
Yeah.
no.
Don't get
You
all
guys
from
work
it.
on that.
It is gonna change.
No, I'm trying to get our
just want that in there
credentialing
in case
files and
somebody's
privileging
relative
files. I
shows
mean,
You know.
Gallagher's is this big. It's just
Yeah,
for all that
over
time. I'm trying
this.
to this.
Somehow, it
Minimal
doesn't make a
paper
lot of
as
sense to me
possible.
why they would
Why
get
print it
so
10
specific
times when I
about
can
that word.
email it
Yeah.
and click, and then I have it on my cloud
But-
drive.
That's a state issue.
And actually, something about signing the checks, I like to come into the county and try it.
No, the county was done exactly.
Why?
What are we paying this
If it
for?
wasn't for the state, it would have been done 6 to 8
Yeah, I
months
like
ago. This whole process.
Yeah.
Although I think it's a waste of time.
Yeah, I don't think the state likes people thinking they might
Except
have
we
given
would-
it to somebody else.
Well,
Yeah, that part.
Because
Yeah, but
that's
for
just
example,
a
wouldn't happen
lot of
otherwise,
signing.
would you?
No, I know that.
There'd
but
always
it's
be
too
somebody
bad
come up.
we
the
can't
commissioners
say.
just dumped the
Yeah.
whole thing and
Meet
said,
with
give
you,
it all
but
back.
I mean, that's just a lot.
Screw
Yeah.
it. Well, a lot of good that does for the community.
You probably
So-
could.
Probably could.
That's,
Doesn't know.
But then you
No,
might
I
find
think that's-
excuses not to meet with us.
That is true.
Yeah. And no services.
Was Jimmy Tate executive
Is this yours,
session
Andre?
too?
That goes to the. No, I forgot to turn it off.